I am Ramesh Ramanathan. I'm a medical oncologist at the Mayo Clinic working in the field of GI cancers, especially pancreatic cancer. Today I would like to welcome Marcia Larson, who is a registered dietitian at the Mayo Clinic Cancer Center and who works with pancreatic cancer patients as well. One of the questions that comes up very often is from patients and families is, does diet cause pancreatic cancer, or is there an association with diet and pancreatic cancer?
That's a great question. We know that obesity, and in particular abdominal obesity, that apple shape right here, as well as a lack of physical activity, is associated with an increased risk for pancreatic cancer. There are some studies that say that diets high in fat and diets high in red meat and processed meats may also contribute to an increased risk, though those studies are inconclusive. The American Institute of Cancer Research has done a lot of reviewing of research, and they have put forth some recommendations about exercise as well as diet to reduce your risk for cancer in general. And those would include staying at a healthy weight through adult life, a BMI range of 21 to 23, getting some physical activity daily, 30 minutes, or up to about 150 minutes per week. Eating a diet rich in fruits and vegetables, limiting your alcohol consumption to 1 drink per day for females, 2 drinks per day for men. In addition to that, reducing or limiting the amount of red meat and processed meats with nitrites, limiting fats, saturated fats as well. And those would all help to reduce your risk for pancreatic cancer.
Thank you. Another question commonly asked is for somebody who's been diagnosed with pancreatic cancer, they do have a lot of GI symptoms and weight loss. So what do you think the most pressing nutrition concerns?
Well, we know that probably the biggest symptoms that one might have with a diagnosis of cancer would be loss of appetite, which then would cause weight loss. Extreme fatigue is another one. Food tastes differently. And then people always comment on the fact that they feel full very quickly. They have diarrhea, or they might have constipation. All of those symptoms lead to the fact that we know, for instance, that people with pancreatic cancer need a lot more calories. But because of those nutrition symptoms, they don't get those calories. And the calories they do consume are malabsorbed because they lack the enzymes to break down those basic nutrients that they so desperately need. This leads to weight loss, it leads to a depressed immune system, and it also leads to the fact that their treatment plan isn't very effective. So we always recommend that you consult a dietitian like myself. A dietitian can help you develop a nutrition plan that is right for you to take care of these nutrition symptoms, and then in turn help that care plan work to its best.
Patients who have pancreatic surgery, particularly a Whipple procedure as we call it, sometimes do get symptoms after surgery, especially weight loss, loss of appetite, bloating. What symptoms can someone expect after surgery, and nutrition-wise, what would you recommend that they should be doing?
Well, your nutrition goal for anyone is going to be to consume adequate calories, fluids, vitamins, protein, and minerals to maintain a desirable body weight. After surgery, it's even more important to regain as much as they possibly can. So we always recommend that they eat a diet that's very low in fiber and fat for the first 6 weeks after surgery, because that's some of the things that are harder to digest after surgery, and so that they can heal properly. After that, it's always important to eat small, frequent meals. It's really important to eat probably every 3 hours, and to make that your job to eat those small, frequent meals. You want to avoid fatty, fried, greasy kinds of foods because your body is not going to be able to digest it as well. You want to limit foods that are high in sugar and refined sugars as well. Oftentimes people after a Whipple will get what we call dumping, where if they eat too many foods that are high in sugar and fat, they get perspiry, they don't feel well, they get nauseated, they may have some emesis, they may have diarrhea, and that can occur right after a meal, or it could happen 2 to 3 hours after. So that's why we want them to be careful about their food choices. You want to consume adequate liquid, about 6 to 12 cups per day, but you don't want to drink those liquids at a meal time. You can have a little bit, maybe 4 ounces that you sip while you're eating your food, but wait for 30 minutes after a meal to begin to drink and stop about 30 minutes before a meal. You want to eat your meal when you're the hungriest during the day. And for about an hour after, you want to stay upright. You don't want to lay down. And don't eat within 2 hours before going to bed. That also helps you to recover after surgery. And finally, you just want to add your foods in gradually. You want to eat soft foods. You want to eat less gassy foods. And you also want to take those pancreatic enzymes that your physician or dietitian has recommended, especially if you're having stools that are yellow in color, that are floating, that are very foul smelling. You want to take those pancreatic enzymes and you want to readjust as you go, but make sure you ask your doctor about readjusting those pancreatic enzymes. So eat slowly, chew your food well, stop when you're feeling full, start slowly, check and make sure that you tolerate each food you add after you have surgery.
Thank you. That's very helpful advice. What would you recommend for patients who are undergoing chemotherapy or radiation? Is there anything different, or they should follow the similar principles?
It's really a lot of the same principles. Again, my recommendations would be that you eat 6 to 8 small meals. Like I said, set a schedule. Don't make it your job to eat. Make sure you have protein at each meal and snack. That's probably something that they have the most difficult time getting in, so make sure you eat some protein foods. You want to chew your food slowly and well. You want to sip those liquids. Make sure you're getting 6 to 12 cups of fluids each day. You want to avoid those simple sugars, even if you didn't have a Whipple, but just in general, you want to avoid simple sugars. You want to avoid those high-fat meals. And all of those things are going to help you to get enough calories in to maintain your desirable body weight, to have enough energy, and most importantly, if you consume enough calories and protein, you are going to make that treatment plan that your doctor has set out for you be the best it possibly can. You're going to hopefully have much fewer symptoms during your cancer treatment, and you're going to feel better. You're going to have better quality of life as well.
Number of pancreatic patients do have diabetes, so that can be challenging, managing your diabetes and making sure you get enough calories. What would you recommend? How is that managed?
Well, because the pancreas is so involved with insulin production and managing your diabetes, it is really important to eat foods that are going to help you maintain your weight, but also keep your blood sugars under control. I always recommend that you speak with a dietitian or possibly have a referral to an endocrinologist who can help manage those blood sugars during treatment if they become elevated. But in addition, you want to just avoid those simple sugars, eat whole fresh foods as much as possible, eat on a schedule, eat those balanced meals, and work with the dietitian to help you get ideas of what would be the best foods to eat with diabetes as well as pancreatic cancer.
Thank you, Marcia. That was very, very helpful, and I'm sure our viewers will appreciate those comments. How does someone get credible information? There's so much out there on the web, and are there any resources? How do you navigate the internet?
That is such an excellent question. There is one book that I really like to encourage people that have had a diagnosis of pancreatic cancer to go on a website to get, and that would be the book from the Pancreatic Cancer Action Network group. They have this book called Diet and Nutrition, Nutritional Concerns with Pancreatic Cancer. I think it's an excellent book.
Thank you, Marcia, for those very helpful comments and suggestions. And I'd like to thank everybody who's watching, and more information can be obtained from the Mayo Clinic website.